Hello everyone, my name is AMAL. In this presentation, I'm going to talk about hemoglobin A1c test. The outline of my presentation: introduction about hemoglobin A1c test, definition of hemoglobin A1c test, importance of hemoglobin A1c test, aim of hemoglobin A1c test, phases of hemoglobin A1c test, and limitations of hemoglobin A1c test. Introduction: the hemoglobin A1c test is a useful, simple, and inexpensive blood test. The hemoglobin A1c blood test is an early screening process for diabetes, both type 1 and type 2, and prediabetes. The test also helps monitor the course of diabetes treatment, where the average blood sugar or glucose quantity over a few months is measured. Definition of hemoglobin A1c test. Hemoglobin A1c refers to galactoid hemoglobin A1c, which identify average plasma glucose concentration to get an overall picture of what our average blood sugar levels have been over a period of week or month. Hemoglobin A1c is also referred to as A1c galactoid hemoglobin test and estimated average glucose. Importance of hemoglobin A1c test: used to diagnose diabetes and used to monitor blood glucose control in people with known diabetes. The symptoms of diabetes: 1. Frequent urination. 2. Increased hunger. 3. Extreme fatigue. 4. Biliary effusion. 5. Excessive thirst. 6. Weight loss. 7. Slow healing wound. The aim of the hemoglobin A1c test: 1. Screening diabetes if the patient have one or more risk factor for developing type 2 diabetes. 2. Diagnosing diabetes if the patient have one or more symptoms of diabetes. 3. Monitoring diabetes if the patient have been diagnosed with type 1 or type 2 diabetes, to monitor how well disease is controlled and how treatment is working. How does the hemoglobin A1c test work? The sugar in the blood is called glucose. When glucose builds up in the blood, it binds to hemoglobin present in red blood cells, forming galactoid hemoglobin. The amount of glucose that combines with hemoglobin is directly proportional to the total amount of sugar that is in the system at that time. The higher the level of glucose in the blood, the higher the level of hemoglobin A1c is detectable on red blood cell. The phases of test: pre-analytic phase. The A1c test is a blood samples with no need for fasting before the test. Analytic phase, analysis methods. Post-analytic phase, interpreting result. Hemoglobin A1c analysis methods. The hemoglobin A1c analysis methods can be divided into two categories. 1. Method based on charge difference. For example, ion exchange chromatography, capillaries electrophoresis. 2. Methods based on structure difference. For example, immunoassay, enzymatic assay, affinity chromatography. The gold standard for hemoglobin A1c detection is capillary electrophoresis. Small size laboratories. The lab have low sample load of 1 to 3 samples per day. They using offers turbidimetry based hemoglobin A1c reagent, which is easily to use and economic. Middle-sized laboratories, the lab have workload of 5 to 15 samples. They're using a solution of NISBA for nephelometry based specific protein analyzer. The large-sized laboratories, the lab have workload of 20 to 50 samples per day or plus. They're using electrophoresis based hemoglobin A1c testing instrument. Interpreting results for diabetes screening and diagnosis. The normal condition A1c level below 5.7%. Pre-diabetes condition A1c level 5.7% to 6.5%. In diabetes condition A1c level 6.5% or higher. For monitoring diabetes control, expired disagree somewhat on what the A1c target should be. The ADA recommended a general A1c target of less than 7% without significant hypoglycemia, low blood sugar. Well, the American Association of Clinical Endocrinologists recommended a general target level of 6.5% or below. The limitation: there are conditions in which the A1c test is not a reliable source for diagnosis diabetes, include any variation from the normal values due to condition such as severe bleeding, lack of sufficient iron in blood, presence of hemoglobin variation, certain medications the patients may be currently taking may affect the test results.